Hi, this is my abnormal psychology project. For my project, I decided to research Phoebe Buffay from the popular TV show Friends. Throughout the show, Phoebe has a weird and a little bit of a quirky side to her, which a lot of the audience seem to find really interesting and they enjoy about her. But I think a lot of her behavior can be categorized as symptoms of schizophrenia. What is schizophrenia? The DSM definition says that schizophrenia is a severe and chronic mental disorder characterized by disturbances in thought, perception, and behavior. Schizophrenia may result in a combination of hallucinations, delusions, and extremely disordered thinking and behavior. There are several symptoms that I included too that were very particular in her case, which are delusions and hallucinations. Symptoms of delusion are usually false beliefs that are not based on reality. For example, you think a major catastrophe is about to occur, you're being harmed, harassed, followed. These are very common. Many times in the show, Phoebe thinks she's being followed, and she thinks her friends are going to die or someone she knows is going to die. With hallucinations, these usually involve seeing or hearing things that don't exist. You hear voices in your head, you think people are there when they're not there. You're talking to imaginary people. Many times Phoebe in the show is caught talking to her dead relatives, her grandma, her mom, and they're not really there, but she believes they're there. Or she talks to voices in her head. I've included some video examples, so I'm going to show you these. This is an example of delusion.
Oh, honey, I'm sure there's nothing wrong with the plane. All right, look, I have to go. I love you, and I will call you the minute I get to Paris. That was just my crazy friend. She told me I should get off the plane because she had a feeling that there was something wrong with the left phalange.
That doesn't sound good.
I wouldn't worry about it. She's always coming up with stuff like this, and you know what? She's almost never right.
But she is sometimes.
Wow.
Okay, so that was one example. A second one, here's one that is an example of hallucinations.
Oh my god, no! Shoot, Kitty! No! I just have this really strong feeling that this cat is my mother. In the monument in Montauk, she was a cat.
What makes the fact that she owns beachfront property all the more impressive?
No. She was a human lady. This is the spirit of my mom, Lily, the woman that killed herself.
Are you sure she's in the cat? Have you been taking your grandma's clock?
Okay, so that was an example of hallucinations. So, there isn't an exact pinpoint on what causes schizophrenia or this disorder, but there are many leads on it. So, they usually lean towards a combination of genetics and family, your brain chemistry and the makeup of it, and your environment around you, like family, friends, and just your social life. So, schizophrenia runs in families. If you have someone directly related to you, that increases your chance of developing it by 10%. And research has shown that the most prominent environmental factor is psychosocial factors, which is a makeup of different kind of social interactions with friend, family, and environment, and just social. So I'm going to go over the course now of how I think how her schizophrenic behavior started. In her childhood, her father ran out on her. Her family didn't have much money growing up. Her mother then remarried but had a drug issue. Then she ended up killing herself. Her stepfather then was also landed in prison, which put her and her siblings on the streets. So she talks a lot, about how, traumatizing her childhood is, and that could be a very big effect. The environment around her, that was a very prominent environment around her at the time. And going into her teenage years, she lived on the streets, but she struggled even more. She was forced to live with homeless and sketchy people, and most of the time she was actually homeless, living in boxes. Her best friend in junior high school died. She got struck by lightning. She dealt with a lot of drug dealers, thieves, and killers, and she was a thief herself, and she did some pretty questionable things. in her early years. So she talks about it with a lot of shame, but I think it's something that really affected her. In her adulthood, she doesn't show any signs of sadness, but she shows a lot of signs of delusion and hallucinations. In this picture over here, she says, "I can hear the voices in my head again." And if you watch the show, you will know this is like not something uncommon. She says things like this like very commonly. She thought she was possessed by an old woman once. She thought a cat was a reincarnation of her dead mother. That was the video you just saw earlier. She often saw dead people and spoke to them. Thought she was cursed and her friends were going to die sometimes, or anybody close to her. Like if she had a feeling somebody was going to die, she would freak out really bad. So the prevalence of schizophrenia is, there's not many people in the U.S. with schizophrenia. It makes up less than 1% of the general population. But even though it doesn't make up a large amount of the population, the effects of it are still so surreal, and like they're really bad. Anybody who has schizophrenia suffers from, they suffer more drastically from suicidal thoughts and are more prone to die, basically just because of how they're feeling, how they think, and automatically having schizophrenia reduces your life by like 15 to 20 years. So, yeah. And here's a video progression, but it's like 7 minutes long. And so if you want to watch it, Barum, you can just like watch it on your own because there's a time limit on this screencast. Here's my work cited. Now we're going to move into Unit 7, which is the treatment of psychological disorders, which would be the treatment of schizophrenia. So, treatments. Antipsychotics are the most common form of treatment for individuals with schizophrenia. These significantly reduce positive symptoms. There are positive and negative symptoms with schizophrenia. Positive are dealing with hallucinations, delusions, and things of that sort. And negative symptoms are dealing more with being withdrawn from society, family, friends, not wanting to talk, being really blank, showing no emotion. Those are the negative symptoms. So after taking the medicine, it's highly recommended to take the next step, which would be therapy. And this significantly, or it can help decrease the positive symptoms after you deal with the negatives. It usually takes up about 6 weeks for the first dose of medication to start reducing symptoms, and it usually takes several months before you feel their full effects. You should wait at least 12 months after, like when you're on good mental health, for 12 months until you even decide to stop taking the medication. And even then, many doctors recommend that you don't and you stay on it. But if you do decide to stop taking your medication, it's up to you to make sure they don't come back as strong and to be in control of them. If not, it'll just take over you again. Antipsychotics was, at first, the first antipsychotic was chlorpromazine, but it wasn't made originally for psychotic issues. It was made for something completely different. But then the Ron Polnick company was urged by many people to release it out into the public to help deal with many disorders, because even disorders then were very prevalent in society. Two psychiatrists, Jean Delay and Pierre Daneker, then worked at St. Anne's Hospital in Paris using chlorpromazine to treat patients, including people suffering with mania and schizophrenia. So it started becoming pretty prevalent in the 1950s around this time. Or like it came out in the 1950s and became more used in like the 1960s. So this is my video kind of explaining it.
In this lecture, we are going to cover pharmacology of anti-neurotransmitter. Dopamine plays a key role in the so-called dopamine hypothesis, which argues that the unusual behavior and experiences associated with psychosis can be largely explained by changes in dopamine function in the brain. Now, dopamine has 4 major pathways by which it affects the brain. Number 1, the mesolimbic pathway, which is thought to be hyperactive in schizophrenia and to mediate positive symptoms of psychosis, such as delusions and hallucinations.
So, dopamine is a main ingredient in this treatment. And they talked about psychosis, but it also this is the same process for schizophrenia as well. So thank you, and I hope you learned something.